Well, good afternoon, everyone. Thank you all for joining us today for this special community update on the local COVID-19 situation. Appreciate you joining us at fairly quick notice. And this will be a fairly uh, you know lighter version than our regular ones back when we were doing this on a routine basis. We're just going to focus on some messaging from Dr. Piggott today. So, and then media will have a chance to ask questions at the end. So what I'd like to do is start us off with a moment to appreciate our connection to our beautiful environment and to each other with a land acknowledgement. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Full Soleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, I'm now going to invite Dr. Piggott to share these next few slides and give us our update. Go ahead, Dr. Piggott.
Thank you so much, Brittany, and thanks everyone for joining us today to talk about this situation. To start, I think I need to share that I am concerned. I am concerned by what I am seeing with our transmission and risk index. I am concerned with what I am hearing, especially from our health system partners, a healthcare system that's experienced so much in these past 2 years with difficulties of delayed procedures and the impacts and burden of COVID-19, with the impact of staffing shortages due to people off and home sick. I am concerned by what I am hearing about the health system's capacity to deal with what we are into already. And that is the sixth wave of this pandemic. We are seeing significant transmission rates. And last week, looking at our wastewater evidence in particular, we surpassed even the January peak of Omicron in terms of the level of transmission we're observing in the community. So this week, I am sharing our COVID-19 risk index along with cautionary messaging about the roles and responsibilities we all have and need to be taking now to prevent this situation from getting any worse. We're currently at a high risk based on our index that's composed of the indicators, as we've already shared. And we've seen a progress in some of the indicators worsening in this past week. It hasn't yet pushed us into a very high overall risk rating, but we are close. And I'm very concerned if the trend that we're observing continues, that very soon we will be into that position. We have seen a worsening in several of our indicators, including deaths in the past week, and now are at very high in terms of the actual case rates we are seeing and the PCR test percent positivity we are seeing. Overall, this high risk rating means we all need to be taking measures to prevent the transmission, including my strong recommendation that we continue masking for the time being. And we all need to be mindful about the kinds of spaces we are engaging in, especially maskless, and the kinds of people we are seeing, especially as we head into holiday time soon here. And I'll come back to that shortly. To do a bit of a deeper dive into some of the data, I'll go to the next slide, please, Brittany. When we look at our wastewater surveillance, you can see here in Peterborough, it has surpassed the January peak of Omicron in the Peterborough wastewater surveillance that we're using. On to our next slide, Brittany, and these slides are available on our website now. We are seeing a very significant increase that has been evolving in the Lakefield sampling as well, and it also has surpassed the peak. In Millbrook, we are also seeing an increase. Into the next slide, Brittany, please. Norwood, we saw that levels from January never actually significantly decreased. So hopefully this is a positive thing that things have not gotten worse recently, but you can see the levels never really did decrease like they have in several of our other sampling regions. And next slide, please, Brittany. Finally, in Havelock, a similar trend has been observed with another increase, albeit less steep, more recently. Provincially, this is consistent with the picture in now all regions of the province, but you can see where we fit in the Peterborough Public Health region, the Central East region in particular, is on the steepest incline and already regionally surpassing the Omicron transmission peak levels. I want to spend a moment to talk about a few things as we're looking at the next couple of weeks, because I think if we all come together and take precautionary measures now, we can avoid this situation from getting worse and from potentially having a very negative impact not only on our healthcare system but our communities. And I want to say that the prevention that we do in public health is not and should not just be focused on preventing the hospitals from becoming overwhelmed. As I've articulated, the message we are hearing is one of significant concern with healthcare partners articulating that many people are off sick and staffing levels are down. We are seeing that the cumulative impact of deferred procedures and deferred healthcare over the pandemic is catching up, and that the hospitalization rate due to COVID-19 is now increasing as well, with 22 inpatients at the PRHC at this present time diagnosed with COVID-19. That doesn't include the broader burden of patients and those who are suspect but not yet confirmed to have COVID-19. So overall, I think there needs to be a lot of caution with the concerns on the healthcare system. But I want to emphasize the only goal here is not to prevent impacts on the healthcare system. In the Omicron wave, we saw many people get very sick in the community and even die in community settings. And I am concerned now, too, in the coming weeks, we will see more people become sick and we will see death even in community settings, regardless of hospital capacity. And beyond that, I think it's really important that people understand that COVID-19 is not a mild illness. This still is no cold. This still is no flu. The severity is much worse. And the concern, too, is with the longer term impacts of the infection on people. We know that the impact of long COVID can be debilitating and disastrous for some people. As an example, I just this morning was speaking with a healthcare provider in our community, a passionate healthcare provider in our community who's been off for a prolonged period of time and unable to provide care because they themselves had long COVID. And this was somebody otherwise healthy, young, who has been significantly debilitated by this illness. And so, as much as I do not want people to start to feel guilty and significantly concerned about it if they do get infected, I think it is still tremendously important to recognize there can be longer term consequences of this illness for all people, even those who are not at risk of severe disease, and that it's really important that we try to do our best to prevent this transmission. The things that we can do are numerous. We have many tools in the toolkit responding to this pandemic. The vaccine continues to be the best tool in the toolkit, but other things are important now. And strongly, I am recommending continuing to wear your mask at the present time. For everyone, but especially those who are at high risk of severe disease, upgrading your mask is really important. A tightly fitted N95 or KN95 style respirator is really important. In the community, we need to be careful still about interactions and gatherings. And in the lead up to holidays, recognizing Easter, Passover are coming, and Ramadan is here, it's really important for everyone to be careful about who they are seeing. And if you are going to be seeing somebody who's at vulnerable risk, who is at risk of severe disease, such as somebody who is elderly, immunocompromised, medically at risk, or as yet unvaccinated, it's really important that you think about the other people that you're seeing and the other activities you're doing in the lead up, because your decisions and your activities could put others at risk. Even if you do not have symptoms, you could still transmit the infection. Rapid antigen tests and staying home if you're sick continues to be critically important so that we can diagnose and stop the spread of this infection. And spending as much time a little bit further apart and outdoors as the weather is getting better will also reduce the impact and transmission on this community. We did hear today announcements regarding fourth doses for specific populations. And I think that can be important, but we are still concerned that many people who are eligible for their third dose have not come forward for that. And I think people need to understand and realize that this is an important protection against severe disease as well. The third dose is really important and is strongly recommended at this stage. And I think that if you are somebody who has had two but has not yet gotten the third, in the context of this sixth wave we are seeing, that is a very important idea to do as soon as possible. So I'm going to conclude by just emphasizing as we are going into this fourth dose phase for those eligible with a provincial announcement this morning. The booking system will open tomorrow, and appointments are required for the time being for our vaccination clinics, please. So Brittany, we'll just go on to the last piece that I wanted to make here, which is testing and treatment. The last piece that I'd like to emphasize is I think that many people do not actually realize that they are at high risk of severe COVID-19 and that they could receive a treatment. What I will simplify and say, because there is a fairly complex um, description of who qualifies for treatment, if you are not young, healthy, and fully vaccinated, at least seek testing and consideration for treatment, and physician assessment will determine whether that is appropriate. It's a complex decision to make whether you can receive treatment, but what I'm hearing about is many people who are eligible that aren't getting treated, and I really want people to start thinking more about whether they're potentially eligible. The treatment needs to start within 5 days of the onset of symptoms, which means that we have a very short window to get people tested, the confirmed test result back, and start treatment. So if you are not young, fully vaccinated, and completely healthy, at least consider you may be eligible for testing and treatment and seek that out. Next slide, Brittany. Thank you so much, everyone, for coming. Again, just to conclude, I think we are at a concerning phase. None of us want to be here again. And I do not know what the next couple of weeks will bring, but the trajectory we are on is deeply concerning. And there are things that we can all do, especially the preventative measures that we've learned and known through the pandemic that protect us and save lives. These are things that we can continue to do, and we can get through this. But I think that it's really critical for everyone to do their best. This isn't just about you and your health, it's about the health and whether people around us in this community will survive this next wave. Thank you.
Thank you very much, Dr. Piggott. Okay, let's now hear from our media guests. I see we've got a great turnout. Thank you everyone again for joining us. Let's start with our Kawartha Now reporter, Paul Rellinger. If you've got some questions for Dr. Piggott, please go right ahead.
I do. Thank you, Dr. Piggott, for updating. You're right. It is concerning to a lot of people, obviously. I want to talk to you about the mask mandate that was lifted on March 21st. Um, in retrospect, or maybe even at the time that it was lifted, was it the right timing to do that?
Well, what I can say is that we had a significant number of cases of COVID between the middle of January and now, even between the fifth and the sixth wave. And so I think we were starting to see an increase, which has accelerated since the mask mandate was lifted. I don't have all of the context and information that was obviously necessary, which sometimes is more than the public health evidence at a provincial level to say whether that was the right or the wrong decision. But I am strongly recommending masks at this time because we do know from the evidence that they will protect not only you, but those around you. And I think it's critical, especially, in indoor settings with people outside your household bubble, at work at this stage, at school at this stage, indoors in a larger gathering. If it's not your household, the mask can protect and it could potentially save lives, maybe not your own if you happen to be fortunate enough to be at lower risk of severe disease, but perhaps those around you. And I think that when we look at anything we do to prevent disease, we always think about the balance, the pros and the cons. And really the reality is, rather than a bit of continued um, 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 nuisance for some, obviously, the mask continues to be a very effective tool, and it's really important that we keep wearing it for this time until the transmission risk decreases in our community.
And not to belabor the point, but just as a follow-up, would it have been your preference back on March 21st that the mask remain, you know, part of the regulations? In
Well,
hindsight, based on where we are now.
well, Paul, I went to a grocery store in our community one evening this week, and I was wearing my N95 style type mask in the grocery store. And I was the only individual in that entire grocery store, other than, I want to send kudos to the teenage kid who was collecting carts in the parking lot outdoors. He was wearing his mask, and that was the only individual amongst staff and residents that I saw wearing a mask. That would not have been the case several weeks ago. So I'm quite concerned that people have changed their behavior in the last couple of weeks, and I'm imploring people to put masks on at least for a little bit longer, because it will help to stop the spread of this sixth wave.
And just one more thing, if I could, it's kind of along the same lines, but all through this pandemic, it seemed that, now this could be just me, and I don't know if you'd agree, that public health and government seemed to be on the same page for the most part through the course of the pandemic. There's a growing feeling that I'm sensing that people are hearing direction from Queen's Park and then hearing another message from public health. Just in terms of the message from public health is obviously more urgent than it seems to be coming out of Queen's Park. And people, there seems to be a real conflict. Do you sense that as well at all, or?
Well, I don't know, Paul. My job's here in Peterborough, and I'm not there, and I don't know all the factors that are obviously being considered there. But what I will say is, I think that everyone has a desire to move on from this pandemic, except for this virus, and continuing to follow the evidence and the guidance, and to take preventative measures, at least those that come with no harm, especially if they can save lives of those around us. That's something we all need to be, willing to do, and be in this together. I mean, as you know, people in this region, as Canadians, I think we need to be able to do this, to be in this together, and to protect each other.
And if I could, again, just keep saying one more thing, but one more thing. When we look at the numbers back in January, which were ridiculously high and alarming, um, are you concerned that the advice you're giving today and giving it very strongly isn't followed? We could see a return to those numbers. Is that likely or possible?
Do you mean in relation to hospitalizations?
Hospitalizations, a number of cases, the whole spectrum, I guess.
I think we are far beyond the number of cases that we saw in January at any peak time already. We know that hospitalizations are a lagging indicator. We know that deaths are a lagging indicator, and I'm very concerned that those will follow the same trend that we saw in the fifth wave, the fourth, the third, the second, the first. And I'm quite concerned with what the next few weeks will bring. But behaviors, decisions that each of us make today can potentially help to change the trajectory of how much transmission there is.
Thanks so much, Dr. Piggott. I appreciate it.
Thank you, Paul. All right, Katrina Squazin from Global News. If you've got some questions for Dr. Piggott, please go ahead.
Hi, Dr. Piggott. We saw from the data that you showed regarding the wastewater that over the past month, a lot of people have become infected with COVID. And I'm wondering what the messaging is around after you've been infected and after you feel better. What precautions should you be taking? Do you still have to wear a mask? And just what is your messaging around people who have gotten COVID recently?
Yeah, thank you so much for that question, Katrina. I think one of the challenges is not everyone will know that they had COVID. Our testing process has changed. Not everyone necessarily has access to rapid antigen tests. And so I think that there's a lot of illness out there that we don't even know is COVID. And that's the first challenge because if there are other viruses circulating, and we know now flu is circulating along with some other viruses. It could have been a different infection, and people could still be susceptible. And even still, a lot of the evidence on waning immunity and reinfection is still emerging. We still have very low certainty on how long it would take after an infection until you could be susceptible to getting the infection again. We hope it's a couple or a few months, but we don't know that. And we know if you look even before this pandemic and before COVID, coronaviruses, which this is, used to circulate. Some of the cold viruses, as an example, were coronaviruses. And we could get infected with the same coronaviruses multiple times in a winter season. Anybody with kids in school or daycare would have at some point probably experienced the week in, week out new virus. The reality is with the coronaviruses and even with the vaccines that we have against them at this stage, reinfection is possible. And so the only tool that we have can't just be vaccines. We need to reach into the toolbox of other preventions as well. And continuing to wear a mask is an important one. So, yes, I think regardless of whether somebody has tested positive recently, mask use at the present time, at this very high level of transmission that we're seeing still, should be a part of everyone's prevention that they're doing.
Okay, and going back to the first slide that you showed, the very first category, I believe it was something to do with cases or case counts, but that was at a very high level. So can you talk about, thank you, Brittany, the case rate? So what makes it very high and what data goes into that? Why is it very high opposed to just high?
So that's based on our thresholds. The thresholds were generated looking at the highest peaks from Omicron and other data and information, and we've already exceeded that when you look at the number of cases. So I am quite concerned about the case rates. They're very high at this stage, and I'm also quite concerned. By the fact that we are already at a very high risk when we look at the number of hospitalizations in the region. And as I mentioned, hospitalizations and deaths, those are lagging indicators that will likely take a couple of weeks to start to increase in the same way. In other jurisdictions where we have seen preventative measures removed and case rates climb, we have also seen hospitalizations and deaths subsequently climb. So I'm very concerned with where in this region we're headed in the next couple of weeks.
Okay, and lastly, you sent out a tweet a couple of days ago that I think was misinterpreted a little bit regarding the illness that we're seeing in schools and children being dismissed who are not fully vaccinated. Can you just, I guess, clarify what we're seeing in schools and when children would be dismissed from a school?
Thank you for that question, Katrina. So we are seeing significant transmission in school settings. At this stage, we are seeing significant number of students that are homesick from school and absent from school. And we are seeing a significant number of rapid tests testing positive. So since last week alone, we've seen 7 of our schools that have exceeded absenteeism thresholds in a concerning way. And looking into the testing, we have sent letters home to 2 schools now recommending that for any student, staff, that are not fully vaccinated, that students stay home for a period of 5 days. This is both to protect from onwards transmission, because people who are fully vaccinated will have less risk of onwards transmission. And it is also to protect them, to protect the student that has not yet had the chance to have the vaccine and is not themselves protected. So this is consistent with what we have been doing in collaboration with our school boards here since January, and we continue to do this.
Okay, thank you very much.
Great. Thank you very much, Katrina. Okay, Matt Latour is here with us from Old and Freak Radio. If you've got some questions for Dr. Piggott, please go right ahead.
Dr. Piggott, thank you so much. It's Jordan in for Matt, and actually Katrina just asked my question, so shout out to Squazen. Appreciate it. Thank you.
Okay,
Thanks, Matt.
great. Thank you very much, Jordan. All right, let's hear from Angela joining us from Peterborough, Canada. Nice to have you with us today, Angela. Did you have some questions for Dr. Piggott?
I think everyone has covered it, but thank you, Dr. Piggott, and thank you, Brittany.
Okay, great. So I'll turn it over now to Bill Hodgins, who's joining us from My Kawartha, Peterborough This Week, and the Examiner. Go ahead, Bill.
Yeah, just a couple of questions. I'm hearing people say that are reluctant, I guess, to get the booster. That why are they pushing it? Because people are spreading it. They even have the booster. Is there a maybe you can say whether or not you're more protected with the booster? You're less likely to spread it. What message can we give to those people?
Yeah, of course, Bill. Thank you. So there's two pieces. With the booster, we know that the risk of spreading it goes down, but the risk of severe disease goes down as well. When we've looked at the data, it is helpful and protective. Especially in people who are at risk of more severe disease, but in everyone, it is protective still against hospitalization, ICU admission, and death. And so the booster dose is really critical protection. When we started vaccinating a little over a year ago, the safety was really well studied and established, and the effectiveness of the vaccine was known, but the duration was short because we're in a crisis, we're in a pandemic, and we didn't know, we didn't have decades to watch how people's immunity will wane over time. Since then, we've been able to track the science, which is why the recommendation for the third dose has gone out. And now most people aged 18 and older, are eligible for a third dose and will be protected by it. And now, obviously, with this morning's provincial announcement, there is the highest risk group also eligible for a fourth dose, and that will add some important protection for them. I am quite concerned for people that have had one or two doses that their protection is being left behind. And Brittany's just sharing from the Ontario Science Table the graph that really demonstrates that and that significant benefit. So if you scroll down a little bit to these bar charts there, Brittany, you can see the difference again with at least two doses versus unvaccinated, and the gap widens with hospitalization and ICU admission. So these are important protections, and the protection is even greater with three doses than just two. Thank you.
Okay, and my second and I think last question. It's kind of a follow-up to what Paul was asking earlier. There's been some criticism of the province for lifting the QR mandates and mask mandates. Do individual health units have the authority to reenact them themselves? And if they do you see that happening, or why isn't that happening?
Thanks, Bill. I mean, I think early in the pandemic, some individual health units had put measures in place. The legislation that's under is called the Health Protection and Promotion Act, and there's a section called 22 where there are orders that can be done in relation to communicable disease. This is generally a tool used at the individual level for one person who's got an infection, but can also be issued to a population. But it is not the best tool because of significant challenges with the enforcement and with the inconsistency from health unit to health unit. If not everyone is aligned with that, it is not the best tool, which is why the province did step in with provincial legislation, and that legislation through the Reopening Ontario Act and the measures in that, which is now being sunsetted, those measures consistent across the province had the biggest impact in improving, protections from the vaccine passport and from masking. And so at this stage, there is legislation that could be used at a local level for a whole number of reasons, including inconsistencies with health units. If we were to use this to require something in the Peterborough Public Health Region, but it wasn't required in neighboring health units, people could go to those places just as easily, and perhaps they're working, or they could go to a venue elsewhere and be at just as high risk of infection. And then beyond that, there is the concern with the enforcement challenges around this legislation. I think that right now, what we have been trying to do is to strongly recommend and really hope that everyone will put their masks back on as a particular piece. But ideally, this kind of an issue is solved through provincial legislation, not local Section 22 orders in response. And so it is nonetheless something that I am considering. It comes with significant challenge and implications. It is something that we are looking at and we would consider, but at this stage, it is not ideal. And I hope with the evolving context, there would potentially be provincial consideration of the precautions that are needed in the context of mitigating the sixth wave.
Excellent. Thank you very much.
Great. Okay, thank you, Bill. And I hope folks are okay if we go a little bit over. Reg Watson, did you have any follow-up questions?
If I could just follow up on the school piece, are you able to say which of the two schools that you mentioned had letters put out?
I don't think we're publicizing that, Reg, and nor would it be helpful. At this stage, we're seeing significant transmission in many schools, and I think the messaging that's most critical is to continue wearing masks, even in school settings. And for those who haven't been fully vaccinated yet, especially kids, it is not too late. Now is a great time to come forward and to become vaccinated. It will be added protection.
We were also wondering, are you finding a lot of repeat cases with kids, kids that were dismissed from the school and then come back and then get infected again? How does that work?
There is certainly lots of evidence of repeat infection in the pandemic. I can't tell you a number, and nor would our region be the best place to study it as a smaller region. That's probably a better scientific question for the province, to look at really the rates of repeat infections. From the evidence in the literature that I'm seeing, it's not as common for perhaps a couple of months, but it is possible. And certainly beyond that, the fact that somebody did have an infection may not really decrease their risk of getting it all over again. And with the infection, again, even if it is mild for somebody, does potentially come with the consequences of long COVID, of these residual symptoms that can last months or years afterwards and can be very debilitating. And so I think it's really critical that people understand this and understand how important all of the suite of preventative measures that we have are to continue, responding in this pandemic.
Okay, and one final question, just so I'm clear, you had mentioned about the threshold for schools. Is that 30% absenteeism?
Yeah, that is the value that was assessed in collaboration with kind of neighboring health units and the school boards. But we're looking at some of the reporting data on the rapid antigen tests as well, and taking the full picture into context, in the with the purpose of protecting kids, obviously in school settings.
And sorry, so what gets triggered once a school does hit that 30%?
We are communicating with that school, and letters are going home with the strong recommendation of individuals who are not yet fully vaccinated to stay home for the period of 5 days. In addition, there are other, pieces that the school is obviously working on. They continue to be good partners to us, continue to strongly recommend masking and other measures to prevent transmission in school settings.
And that's the process that's been in place since the start of January.
Correct.
Okay, thank you very much for those answers.
Wonderful. Thank you very much to our media partners, and thank you again, Dr. Pigott. So we will bring this to a conclusion. I encourage everyone to continue checking the Community COVID Risk Index. It is available on our homepage, as well as we have introduced a pre-recorded phone greeting through our main phone line at 705-743-1000. So those without a computer can hear the latest level and the guidance. So please make sure to check that on a regular basis. If you have any other questions, you can follow up with me offline. And with that, I wish you well, and please stay safe out there and wear your mask. Thanks now.
Thanks, everyone.